C. Current information. D. Informed consent. E. Confidentiality. F. Refusal of treatment. G. Reasonable response to a request for services. H. Right to know hospital/clinic regulations. Bill of Rights. Informed consent. Informed consent is client's agreement to have procedure performed after explanation of risks, benefits, expectations, and alternatives can be withdrawn at any time. Nurse ensures it is signed and attached to chart. Bill of Rights. Informed consent. Minor. Bill of Rights. Informed consent. Minor. Bill of Rights. Refusal of treatment. Self-Determination Act, federal law requiring healthcare facilities to provide written information to adult clients about their rights to make healthcare decisions. They can refuse any care, which includes aggressive treatments to save their life, made of living will, or power of attorney. Bill of Rights. Confidentiality. 1. Right to privacy of records. 2. Information used only for purpose of diagnosis and treatment. 3. Not released to others without permission. Verify identity of persons asking for information. Managed care. System for planning and monitoring care of person from time of contact through discharge to ensure standard care is given and costs are minimized. Managed care. Managed. Managed care. Successful. Managed care. Variance. 1. Deviations from specific plans. 2. Information is included in a database and is used to evaluate services provided. 3. Continuous quality improvement strategies are used to monitor variances. Healthcare financing. 3 primary ways healthcare services are paid for are direct payment by client using own money, private insurance, government programs. Managed care, PPO. Preferred Provider Organization, a type of health plan that contracts with medical providers such as hospitals and doctors to create a network of participating providers. You pay less if you use providers that belong to the plan's network. Managed care, HMO. Managed care, POS. Point of service plans combines HMO and PPO, a type of plan in which you pay less if you use doctors, hospitals, and other healthcare providers that belong to the plan's network. POS plans also require you to get a referral from your primary care doctor in order to see a specialist. Delegation. Delegation. Rights of delegation. A. Right task. B. Right person. C. Right time. D. Right information. E. Right supervision. F. Right follow-up. Delegation rules of determining a delegate. Delegate to lowest person on hierarchy who has the required skills and abilities and who is allowed to do the task legally and according to the organization. Delegation levels of delegation. Delegation reassigned RN. Delegation LPN may assist with implementation of care perform procedures, differentiates normal from abnormal cares for stable clients with predictable outcomes, has knowledge of asepsis and dressing changes, may administer medications according to educational background and state nurse practice acts. Allocation of healthcare resources. Decisions regarding how healthcare resources will be distributed. There is a finite number of resources in healthcare that must be used wisely and efficiently. Primary purpose is to provide the greatest good for the greatest number of people. Quality assurance. Quality assurance in nursing is about ensuring adherence to quality standards as mandated by nursing regulatory bodies. Quality assurance in nursing assesses what healthcare processes are in place and what else needs to be implemented to better the system. Legal nursing responsibilities, risk management. Legal parallel quality assurance, the focus on preventing harm, injury, disability, or death to clients, visitors, and staff by preventing accidents and financial loss to the institution. Healthcare barriers. Poverty, high cost of care, inadequate or no insurance coverage, lack of availability of services, lack of culturally competent care. Healthcare barriers impact. Barriers to healthcare can cause unmet health needs, delays in receiving appropriate care, inability to get preventive services, financial burdens, preventable hospitalizations. Organ donation. Team building. Goal is to create a type of synergy in which the effect of everyone working together toward the shared goal results in greater total effect than could be achieved by the sum of the efforts of everyone working individually. Team building competence. Are you a good listener? Do you communicate ideas clearly? Can you accept criticism? Do you support others? Do you ask good questions and contribute? Are you a team player? Can you deal with change and conflict? Are you self-motivating? Nurse Practice Act defines reasonable care in each state, scope of nursing practice, rules, educational requirements, licensure requirements. Legal terms: assault, intentional threat to cause harm or offensive unwanted contact. Legal terms: battery, intentional touching without consent. Power types: coercive, involves using threats or punishment to enforce desired behaviors. X, Board of Nursing will revoke license if nurse is not using safe nursing practice. Power types: legitimate, Power you derive from your formal position or office held in the organization's hierarchy of authority, based upon perception and reality. It is based on the reality that a person holds a particular position in an organization. X. Police officer or nursing director. Power types. Referent is gained by an individual because others like and admire that person or what the person symbolizes. Power types. Expert involves having specialized skills and abilities that serve to accomplish desired goals or influence others to follow one's leadership. The individual with particular skills, knowledge, and ability will have power in the area where these skills are important. Power types. Informational exists when an individual possesses information that others need or want to accomplish a goal. X. The person who has access to information about the unit's budget. Power types. Reward can be seen anytime one individual rewards another with positive statements or compliments. Power types. Connection the cumulative effect of more than one individual working toward a goal, responsible for the effectiveness seen in networking. Good Samaritan laws limit the liability of professionals in emergency situations when they are off duty. On-duty professionals are liable. Legal terms. Malpractice professional negligence involving misconduct or lack of skill in carrying out professional responsibilities. Required elements. 1. Duty. Legal relationship between nurse and client. 2. Breach of duty. 3. Causation. Nurse conduct causes injury. Substance abuse. Nurse and staff. Change theory. Unfreezing. Recognizing need for change. Change theory. Movement. Actually implementing the change. Change theory. Refreezing. Incorporating new changes into behavior and stabilizing them. Legal term. Negligence. An intentional failure of individual to perform an act that a reasonable person would or would not perform in similar circumstances. Can be act of omission or commission. Spiritual considerations. Essential to consider in planning and delivering care. Priority areas to consider include spiritual beliefs or practices that directly and immediately affect the physical body, such as diet, beliefs about illness, treatment, and death. Teaching learning. Consider specific knowledge needed and whether which type of learning needed is cognitive, psychomotor, and or affective. Assess motivation of client, anxiety level, attitude, and beliefs. Care planning. Developing a formalized plan of care that extends from admission through discharge and provides a written guide for healthcare goal attainment, which includes assessment, nursing diagnoses, and problems, short and long-term goals, outcomes, interventions, and evaluations. Conflict resolution. Steps of conflict resolution include determining facts, identify problem, ask for suggestions from those involved, determine solution, evaluate results, evaluate conflict resolution. Care delivery models. Management system designed to determine numbers and types of nursing personnel to be used to accomplish the most cost-effective, safe, and proficient care of clients. X. Staffing needs. Nurse-client relationship therapeutic. Time management principles. Plan activities, prioritize list of activities, delegate those tasks that can be passed on, take time to do things right the first time, limit distractions, take needed breaks. Restraints, nursing considerations. Nurses' responsibility in critical thinking. Phases of decision making. Phases 1. Define objectives. 2. Generate options. 3. Analyze options. A. Identify advantages and disadvantages. B. Rank options. 4. Select option that will successfully meet the defined objective. 5. Implement the selected option. 6. Evaluate the outcome. Documentation purpose. 1. Promote communication. 2. Maintains a legal record. 3. Meets requirements of regulatory agencies. 4. Required for third-party reimbursement. Documentation characteristics. 1. Legible. 2. Accurate, factual, no summarizing data. 3. Timely. 4. Thorough. 5. Well organized and concise. 6. Confidential. 7. Proper grammar and spelling. 8. Authorized abbreviations. Documentation change in client's condition. Incident report. Agency record of unusual occurrence or accident and physical response. Accurate and comprehensive report on any unexpected or unplanned occurrence that affects or could potentially affect a client, family member, or staff person. Incident report purpose. 1. Documentation and follow-up of all incidents. 2. Used to analyze the severity, frequency, and cause of occurrences. 3. Analysis is the basis for intervention. Incident report charting. Incident report common situations that require an incident report. Ethics definition. Legal nursing responsibilities advocacy. Legal nursing responsibilities, beneficence. The good duty to help others by doing what is best for them. Client advocacy for refusal of care autonomy overrides beneficence. Veracity. Communicate truthfully and accurately. Legal term, justice. Use available resources fairly and reasonably. Fidelity. Following through on what the nurse says will be done, carefully attending to the details of the client's care. Keep promises. Legal term, non-maleficence. Do no harm, act with empathy toward client and staff without resentment or malice, violated by acts performed in bad faith or with ill will, or when making false accusations about client or employee. What is a type A fire extinguisher used for? Ordinary fires. What is a type B fire extinguisher used for? Flammable. What is a type C fire extinguisher used for? Electrical appliances fires. What is a type D fire extinguisher used for? Chemical. How long should a nurse spend caring for a patient receiving gamma ray radiation therapy? 1 hour for every 8 hours of work. When should vomiting not be induced after poison ingestion? If substance contains alkaline or acid agents, household cleaners, oven cleaner, furniture polish, metal cleaners, battery acids, petroleum products. What are the 4 goals of poison control therapy? 1. Remove or neutralize substance before absorption. 2. Give supportive care. 3. Give antidote. 4. Speed elimination. What are the 4 stages of infection? 1. Incubation. 2. Prodromal. 3. Invasive. 4. Convalescence. What are the characteristics of the incubation phase of infection? Time between infection and symptoms. What are the characteristics of the prodromal phase of infection? Time between onset of non-specific symptoms to specific symptoms. Pathogen is multiplying, most contagious at this point. What are the characteristics of the invasive phase of infection? Exhibiting specific symptoms of disease. What are the characteristics of the convalescence phase of infection? Body is returning to normal health. What are the 6 links in the chain of infection? Pathogen, host, reservoir, portal of entry, portal of exit, mode of transmission. What equipment is worn for contact isolation? Gown and gloves along with standard equipment. What equipment is worn for droplet isolation? Mask along with standard equipment. What equipment is worked for airborne isolation? Respirator along with standard equipment. What types of diseases require contact isolation? What diseases need droplet precautions? What types of diseases require airborne isolation? Disseminated herpes zoster, measles, monkeypox, SARS, smallpox, tuberculosis, varicella zoster. In what order should PPE be put on? Gown, mask, goggles, gloves. In what order should PPE be removed? Gloves, goggles, gown, mask. What equipment is required for neutropenic precautions? Gowns, masks, gloves. What is acquired immunity? Not innate. How is naturally acquired immunity brought about? Infection and production of antibodies, placental transfer. How is artificial acquired immunity brought about? Vaccination, immune globulin. What is the difference between passive and active acquired immunity? Passive doesn't last as long. Antibodies transmitted through placenta to fetus, colostrum to infant. Immune globulin active lasts much longer. Antibodies created by own body after exposure. How many doses of the varicella vaccine are required? 2 doses. How many doses of the HPV vaccine are required? 3 doses. How many doses of the zoster vaccine are required? 1 dose. When should the zoster vaccine be given? After 60 yo. How many doses of the pneumococcal vaccine are required? 1 dose. When should the pneumococcal vaccine be given? After 65 yo. At how many months should the Hep B vaccination be given? At birth, at 1 to 2 months, at 6 to 18 months. At what ages should the rotavirus vaccination be given to children? 2 months, 4 months, 6 months. At what ages should the DTaP vaccination be given to children? 2 months, 4 months, 6 months, 15 to 18 months, 4 to 6 years. At what ages should the Hib vaccination be given to children? 2 months, 4 months, 6 months, 12 to 15 months. At what ages should the PCV vaccination be given to children? 2 months, 4 months, 6 months, 12 to 15 months. At what ages should the IPV vaccination be given to children? 2 months, 4 months, 6 to 18 months, 4 to 6 years. How many doses of the initial influenza vaccination are recommended for children? 2 doses 4 weeks apart if given between 6 months and 8 years. When can a child start receiving the yearly influenza vaccination? 6 months. At what ages should the MMR vaccination be given to children? 12 to 15 months, 4 to 6 years. At what ages should the varicella vaccination be given to children? 12 to 15 months, 4 to 6 years. When should the first dose of the Hep A vaccination be given? 12 to 23 months. When should the second dose of the Hep A vaccination be given? 6 to 18 months after the first. What are the 4 disaster management phases identified by FEMA? 1. Mitigation. 2. Preparedness. 3. Response. 4. Recovery. What are the 3 levels of disaster identified by FEMA from major to minor? Level I requires state and federal assistance. Massive damage. Level 2 requires regional efforts and mutual aid from surrounding communities. Level 3, minor to average levels of damage. Local resources are adequate. What are the 3 triage categories in the healthcare setting? Emergent, life-threatening injuries need immediate attention. Urgent, non-life-threatening injuries, non-urgent, no immediate complications, can wait for treatment. Do exposed individuals spread anthrax? No, no need for isolation. What are the symptoms of integumentary anthrax? Localized itching, greater than popular lesions, greater than vesicles, greater than black issue after 7 to 10 days. What are the symptoms of inhalation anthrax? Initial, low-grade fever, malaise, cough, fatigue, myalgia, sweating, chest discomfort, progress to high fever, respiratory distress, shock, death within 24 to 36 hours. What is the treatment for anthrax exposure? 1. Decontamination, remove clothing, shower. 2. Antibiotics, Cipro is drug of choice. How is the plague spread? Through rodents and their fleas. Can exposed individuals spread the plague? Yes, isolation required. What are the symptoms of pneumonic plague? Rapidly deteriorating pneumonia, fever, chest pain, bloody or watery sputum, death within 24 hours. What is the treatment for plague? 1. Isolation. 2. Antibiotics, streptomycin, gentamicin, doxycycline, Cipro. Can exposed individuals spread smallpox? Yes, isolation required. What are the symptoms of smallpox? 1. Initially, high fever, malaise, head and body aches. 2. Progresses to total body rash. What is the treatment for smallpox? No specific treatment, isolation required for infected and those close to them until all scabs have fallen off. If smallpox vaccine given within 1 to 4 days after exposure, greater than may prevent or lessen disease. What happens in viral hemorrhagic fever states? Vascular system is damaged, body's ability to regulate itself is impaired, hemorrhage, greater than not life-threatening usually. What are the 4 disease states in the viral hemorrhagic fever family? Ebola, Marburg yellow fever, Argentine hemorrhagic fever. What are the symptoms of viral hemorrhagic fevers? Initially, high fever, muscle aches, weakness, hemorrhagic rash over entire body, severe, subcutaneous and internal bleeding, bleeding from body orifices, shock, delirium, seizures, coma. What is the treatment of viral hemorrhagic fevers? No cure, supportive therapy. What is the treatment for mustard gas exposure? No antidote, shower, rinse off, leave area. What are the symptoms of sarin nerve gas exposure? Overstimulation of parasympathetic nerves, runny nose, watery eyes, blurred vision, drooling, cough, chest tightness, diarrhea, drowsiness, weakness, headache, changes in heart rate, changes in BP, loss of consciousness, seizures, paralysis, respiratory failure can lead to death in minutes in large doses. What is the treatment of sarin nerve gas exposure? Usually 2 drugs, atropine, pralidoxin chloride, decontaminate before moving to treatment facility. Respiratory support, diazepam for seizure activity can contaminate rescue worker. What are the symptoms of strychnine exposure? What is the treatment of strychnine poisoning? Decontaminate for fluid resuscitation, cooling therapy for fever, anticonvulsants, antispasmodics, muscle relaxants. What are the symptoms of ricin inhalation exposure? Respiratory distress, fever, cough, nausea, chest tightness, pulmonary edema. What are the symptoms of ricin ingestion? Vomiting and diarrhea that may be bloody, dehydration, low BP, hallucinations, seizures, multi-system failure. What are the symptoms of ricin exposure on the skin and eye? Redness and pain. How is ricin ingestion treated? Large doses of charcoal, gastric lavage, aggressive fluid, and electrolyte replacement. What are symptoms of mild radiation sickness? Nausea and vomiting, headache, fatigue, weakness. What are symptoms of severe radiation sickness? Nausea and vomiting, dizziness, disorientation, hypotension, usually death. Practical nurses' role in family planning. A reinforced teaching by healthcare providers on methods of contraception. B. Encourage questions. C. Provide opportunity for women to discuss feelings about contraception. D. Have user explain chosen method. E. Clarify any misunderstandings. Fertility awareness method. 3 common methods used include chemical agents or spermicides. Prevent pregnancy by keeping sperm from joining with an egg, by blocking the cervix, or by keeping the sperm from moving inserted deep into the vagina shortly before intercourse. Products include creams, foams, jellies, or suppositories. Mechanical barrier methods. Birth control pills. Birth control pill, combined hormone therapy. Birth control pill, emergency contraception pill, also called the morning after pill. Birth control patch. Plastic patch that sticks to the skin that releases estrogen and progestin, placed on the skin once a week for 3 weeks in a row, followed by a patch-free week. Birth control vaginal ring. A small ring placed in the vagina once a month for 3 weeks to prevent pregnancy, releases estrogen and progestin. Birth control shot. An injection of the hormone progestin. Each shot prevents pregnancy for 3 months, may delay conception for up to 2 years after discontinuation of the product. Intrauterine devices. Small T-shaped plastic device inserted into the uterus to prevent pregnancy may cause heavy menstrual bleeding, severe cramping, and bleeding between periods. 2 types of devices sold in the U.S. The pericardiate contains copper. The Mirena it releases a small amount of progestin. Permanent sterilization. Nail vasectomy. Types of interruption of pregnancy. Types of methods for interruption of pregnancy. A. First trimester, menstrual extraction, dilation and curettage, suction or vacuum aspiration, microstone and misoprostol, when 8 weeks pregnant or less. B. Second trimester, dilation and evacuation, saline injection, prostaglandins. Possible complications of methods from interruption of pregnancy. Conception. Implantation. Preconception health. Reinforce teaching regarding what makes the amniotic fluid. Kidneys secrete urine that makes it up. Preeclampsia. High blood pressure narrows the arteries of the placenta, therefore reducing the blood flow to the baby. Therefore, baby can become distressed. It usually occurs after the 20th week. Placenta abruptio. When the placenta detaches from the uterine wall before baby is born, therefore you will deplete the baby from nutrients and oxygen and won't be able to get rid of waste. Signs of placenta abruptio. Exposure to teratogens. Medications including isotretinoin, some anticonvulsants, lithium, some antibiotics, thalidomide, warfarin, and angiotensin-converting enzyme inhibitors, alcohol, cocaine use, smoking cigarettes. Laboratory test. The test to determine the type of blood group is: although your blood sample is mixed with antibodies against type A and B blood, then the sample is checked to see whether or not the blood cells stick together. If blood cells stick together, it means the blood reacted with one of the antibodies. Bag typing. The liquid part of your blood without cells is mixed with blood that is known to be type A and type B. People with type A blood have anti-B antibodies. People with type B blood have anti-A antibodies. Type O blood contains both types of antibodies. Which type of blood you can safely receive? The Coombs test. Antigen. Any substance foreign to the body that evokes an immune response either alone or after forming a complex with a larger molecule and that is capable of binding with a product of the immune response. Antibody. Quickening. The first motion of a fetus in the uterus felt by the mother usually somewhat before the middle of the period of gestation. Gestational age assessment PN to have knowledge of these but not necessarily perform. Estimated after duration of pregnancy and estimated date of birth are determined by first uterine size estimate, fetal heart, first heard date of quickening, current fundal height, current week of gestation, ultrasound. Gestational age assessment. PN to have knowledge of these but not necessarily perform. Laboratory test for second trimester. The delivery process is described in these terms. Third trimester laboratory labs. I. Urinalysis for protein, glucose, ketones. E. Antibody screen at 28 weeks gestation if client is Rh negative. E. Cervical culture for group B streptococcus at 34 to 36 gestation if hemoglobin and hematocrit. Hypocapnia. Deficiency of CO2 in the blood. True labor effacement and dilation of the cervix. Risk factors of labor. Fetal heart rate. Baseline heart rate equals 120 minus 160 bpm. Bradycardia equals less than 120 bpm. Tachycardia equals more than 160 bpm. During contractions, FHR may increase or decrease by 30 bpm. FHR should return to the baseline immediately after end of contraction. Late decelerations. During labor, the anesthesiologist has primary responsibility for these anesthetics, but the nurse must know the anesthetic agent used and its effects and side effects, the level of sensory and motor changes to expect, the woman's allergies to medications used for procedure. First stage of labor, active phase. Lasts approximately 4 hours for the primipara and 2 hours for the multipara. Monitor contractions, increased intensity, moderate to strong bipalpation, more regular, about 3 to 5 minutes apart, lasting 45 seconds. Observe membranes intact or ruptured. Measure fetal heart rate every 15 to 30 minutes. First stage of labor, latent phase. Lasts approximately 8 hours for the primipara and 4 to 5 hours for the multipara. Contractions, mild and irregular, more than 10 minutes apart, lasting about 30 seconds. First stage of labor, transitional phase. Healthcare provider performs pelvic exam on transitional phase 1. Dilation 8 to 10 centimeters, membranes ruptured. Check character of amniotic fluid, fetal descent and station. Second stage of labor. Complete dilation through birth, approximately 30 to 50 minutes for the primipara and 20 minutes for the multipara. Physical second stage of labor. Fetal crowning, increased bloody show, mother pushes involuntarily, open glottis, pushing is recommended. Fetal heart rate response to contractions and pushing, check every 5 to 15 minutes. Strong contractions to palpation every 2 to 3 minutes, lasting 60 to 90 seconds. B. Nursing care. Role of PN is to assist the RN, certified nurse, midwife, and physician healthcare provider. Third stage of labor. Placental separation and expulsion, lasts approximately 5 to 30 minutes. Nursing care. Role of PN is to assist the RN, certified nurse, midwife, and physician healthcare provider. I. Monitor maternal vital signs. E. Monitor effects of oxytocic drugs. E. Document promptly and accurately. Fourth stage of labor. Nursing care. Role of PN is assisting the registered nurse, certified midwife, and physician for fourth stage of labor. Endocrine postpartum. I. Estrogen drops at birth. Lowest 1 week postpartum. E. Progesterone drops at birth. Undetectable 72 hours postpartum. E. Oxytocin stimulates uterine contraction and milk letdown reflex. If prolactin stimulates milk production when nipples stimulated. Lochia. Lochia is the vaginal discharge after giving birth containing blood, mucus, and uterine tissue. Lochia discharge typically continues for 4 to 6 weeks after childbirth, which is known as the postpartum period. I. Rubra on days 1 to 3. E. serosa on days 3 to 7. E. alba on or around day 10. Postpartum assessment bubble. B equals breast, U equals uterus, B equals bowels, B equals bladder, L equals lochia, E equals episiotomy, C-section, incision. E can also stand for maternal emotions about the outcomes of the birth and the new baby. Mechanics of lactation. Lactation begins with placental delivery. Assess LATCH. L equals latch achieved by infant. A equals audible swallowing. T equals type of nibble. C equals comfort of mother. H equals help given to mother with nursing. Baby should nurse for 10 to 15 minutes on each side every 2 to 3 hours. Encourage a fluid be consumed by the mother with each feeding and extra per day. 8 ounces 500 calories. General information about breastfeed babies. When to administer Rogan registered trademark. After any possible exposure to fetal blood, for example, after each ectopic pregnancy, miscarriage, or abortion, after an amniocentesis within 72 hours after giving birth, regardless if received during antepartum period. Never administer Rogan registered trademark to a Rh-positive woman, a sensitized Rh-negative woman, that is, someone who has a positive indirect Coombs test, a Rh-negative woman who has given birth to an Rh-negative baby, the baby or father of the baby. First stage of labor, latent phase. Laboratory test for first stage of labor, latent phase. Laboratory test. Compare values to antepartal records. I. Complete blood count. E. Blood type and Rh factor. E. Urinalysis for protein. Variable deceleration. Early deceleration. FHR decelerations that mirror the contraction and return quickly to baseline by the end of the contraction, very common, caused by head compression. No intervention is needed. They are not a sign of distress. Two types of epidurals. 1. Regular epidural. 2. Combined epidural. Regular epidural. A combination of narcotic and anesthesia is administered. Common narcotics used: fentanyl or morphine. Common anesthetics: bupivancin, chloroprocaine, or lidocaine. Fentanyl. Fentanyl precautions. Fentanyl interaction characteristics. ESA3A4 substrate anticholinergic-like effects, bradycardia, CNS depression, serotonergic effects, weak. Fentanyl serious reactions. fentanyl and pregnancy. General info with epidurals. Nursing care of fourth stage of labor. Lactation begins with placental delivery. Prolactin, released from the anterior pituitary, causes the milk production of breast and the moving of the milk to the breast. Oxytocin causes contractions in the breast to let down or release the milk through the nipple, also causes the uterus to contract. Reflexes are present to protect infant until systems mature. How do reflexes disappear? In a cephalocaudal manner. Lanugo, a dense cottony or downy growth of hair, specifically the soft downy hair that covers the fetus of some mammals. Apgariz, Apgar score, breathing. If the infant is not breathing, the respiratory score is 0. If the respirations are slow or irregular, the infant scores 1 for respiratory effort. If the infant cries well, the respiratory score is 2. Apgar score, heart rate is evaluated by stethoscope. This is the most important assessment. If there is no heartbeat, the infant scores 0 for heart rate. If heart rate is less than 100 beats per minute, the infant scores 1 for heart rate. If heart rate is greater than 100 beats per minute, the infant scores 2 for heart rate. Apgar score, muscle tone. If muscles are loose and floppy, the infant scores 0 for muscle tone. If there is some muscle tone, the infant scores 1. If there is active motion, the infant scores 2 for muscle tone. Apgar score, grimace. Apgar score, skin color. If the skin color is pale blue, the infant scores 0 for color. If the body is pink and the extremities are blue, the infant scores 1 for color. If the entire body is pink, the infant scores 2 for color. Why the Apgar test is performed. This test is done to determine whether a newborn needs help breathing or is having heart trouble. Normal results of the Apgar test are abnormal results of Apgar test are any score lower than 7 is a sign that the baby needs medical attention. The lower the score, the more help the baby needs to adjust outside the mother's womb. Most of the time a low Apgar score is caused by difficult birth, C-section, fluid in the baby's airway. Apgar scoring and intervention. Physical examinations. Reflexes of newborn. Glabellar. Tapping briskly on bridge of nose causes eyes to close tightly, disappears around the 4th month. Reflexes of newborn. Glabellar. Tapping briskly on bridge of nose causes eyes to close tightly, disappears around the 4th month. Reflexes of newborn. Rooting. Touching or stroking cheek beside mouth causes baby to turn head to the side of the stimulus and begin to suck, usually stops at 3 to 4 months. Reflexes of newborn. Extrusion. Touch or depress the tongue and it is forced outward, stops at 4 months. Reflexes of newborn. Sucking. This occurs when something is placed in the baby's mouth, slowly replaced by voluntary sucking around 2 months of age. Reflexes of newborn. Grasp. Stroking palm of hand causes flexion of digits. Reflexes of newborn. Babinski or plantar grasp. Stroking outer sole of foot upward from heel across ball of foot causes toes to fan and hyperextend with the big toe in dorsiflexion, usually disappears at 12 to 18 months of age. Reflexes of newborn. Mora or startle reflex. Sudden jarring causes extension and abduction of extremities and fanning of fingers, followed by flexion and adduction of extremities. It is a bilateral process, usually disappears at about 2 months of age. Reflexes of newborn. Dance or step reflex. Holding newborn so feet touch hard surface causes flexion and extension of legs, simulating walking, usually disappears at about 3 to 4 weeks of age. Reflexes of newborn. Crawl. Placing baby on abdomen causes crawling-like movements of arms and legs, usually disappears at about 6 weeks of age. Reflexes of newborn. Parachute. When an infant is suspended in a horizontal prone position and suddenly thrust forward, the hands and fingers extend forward. This reflex is protective. As the child learns to walk, the reflex helps protect him or her from falls, found initially between 7 to 9 months and persists indefinitely. Reflexes of newborn. Tonic or neck fencing. Caput succedaneum. Cephalohematoma. New Ballard's square window. Wrist flexibility and or resistance to extensor. New Ballard's posture. New Ballard's arm recoil. This maneuver focuses on passive flexor tone of the biceps muscle by measuring the angle of recoil following very brief extension of the upper extremity. New Ballard's popliteal angle. This maneuver assesses maturation of passive flexor tone about the knee joint by testing for resistance to extension of the lower extremity. With the infant lying supine and with diaper removed, the thigh is placed gently on the infant's abdomen with the knee fully flexed. New Ballard's scarf sign. New Ballard's heel to air. This maneuver measures passive flexor tone about the pelvic girdle by testing for passive flexion or resistance to extension of posterior hip flexor muscles. Bilirubin. Level 0 to 1 milligrams per deciliter. Appearance of jaundice during the first day of life indicates a pathological process. Evaluation is indicated with hyperbilirubinemia. P. Nursing role of newborn. Mother's initial weight loss after delivery. 12 to 15 pounds after delivery, additional 5 pounds within the first week and 10 pounds in the next 6 weeks. T or F. The fourth stage of labor is placental separation and expulsion. F. The third stage of labor is placental separation and expulsion and lasts about 5 to 30 minutes. The fourth stage of labor is maternal adaptation, occurring 1 to 2 hours after birth. T or F. Most pregnancy tests measure the level of estrogen in the woman's blood. F. Pregnancy tests measure the hormone human chorionic gonadotropin in the urine or in the blood. Levels can be first detected about 12 to 14 days after conception and peak in the first 8 to 11 weeks of pregnancy. One of the first signs of pregnancy is Chadwick's sign, which is the softening of the cervix. There are several findings of pregnancy during the first trimester. Increased vascularity in vagina is called Chadwick's sign. The increased vascularization and softness of uterine isthmus is Heger's sign, and the softening of the cervix is Goodell's sign. The nurse will give Rh immune globulin to Rh negative women after miscarriage. Rogan registered trademark is administered to Rh negative women after any possible exposure to fetal blood, such as after each ectopic pregnancy, miscarriage, abortion, or amniocentesis. Rogan registered trademark will be given to help prevent problems associated with incompatible blood types in future pregnancies. Klausma is the first milk the new mother produces. Klausma is a skin discoloration of pregnancy. The first breast milk is called colostrum. Colostrum is low in fat, high in carbohydrates, protein, and antibodies, and easy for the newborn to digest. The fetus receives more oxygenated blood when the laboring mother lies on her side. Positioning the laboring mother on her side usually results in a higher fetal oxygen saturation. Other measures to increase fetal oxygenation include administering oxygen to the laboring woman. A 3. Para 3 women should be rushed to the delivery room once engagement has occurred. F. Engagement means that the baby's head no longer floats freely but has dropped down into the pelvis. In a multipra, engagement normally occurs about 2 weeks before birth. About 5 days after delivery, lochia is pink-brown in color. Normal bleeding and discharge should be more watery and pink-brown colored about 3 to 5 days after delivery. It may take up to 2 to 4 weeks for discharge to taper off completely. The safest time for the fetus is to give the mother analgesia when her cervix is dilated 8 to 10 centimeters. The safest time to offer analgesia is when dilation is between 4 to 7 centimeters. Anticipatory grief. Person learns of impending loss and responds with processes of mourning, coping, interaction, planning, and psychosocial reorganization. Disenfranchised grief. Person experiences a loss that is not or cannot be openly acknowledged, publicly mourned, or socially supported. Complicated grief. A result of a sudden loss. Mourning. Process used to resolve grief. Bereavement. A state of grieving. Denial. Unconscious avoidance which varies from a brief period to the remainder of life. Positive responses include verbal denial and crying. Maladaptive response includes no crying or acknowledgement of loss. Anger. Expresses the realization of loss. Maladaptive responses include persistent guilt or low self-esteem, aggression, self-destructive ideation, or behavior. Bargaining. An attempt to change reality of loss. Maladaptive response includes bargaining for unrealistic activities or events in distant future. Depression and withdrawal. Sadness resulting from actual or anticipated loss. Acceptance. Resolution of feelings about death or other loss resulting in peaceful feeling. Compensation. Extra effort in one area to offset real or imagined lack in another area. It helps reinforce a person's self-esteem and self-image. Conversion. A mental conflict is expressed through physical symptoms. Denial. Treating obvious reality factors as though they do not exist because they are consciously intolerable. Displacement. Transferring unacceptable feelings aroused by one object to another, more acceptable substitute. Dissociation. Walling off specific areas of the personality from consciousness. Fantasy. A conscious distortion of unconscious wishes and need to obtain satisfaction. Fixation. Becoming stagnated in a level of emotional development in which one is comfortable. Identification. Subconsciously attributing to oneself qualities of others. Intellectualization. Use of thinking, ideas, or intellect to avoid emotions. Introjection. Incorporating the traits of others. Projection. Unconsciously projecting one's own unacceptable qualities or feelings onto others. Rationalization. Justifying behaviors, emotions, motives considered intolerable through acceptable excuses. Reaction formation. Expressing unacceptable wishes or behavior by opposite overt behavior. Regression. Retreating to an earlier and more comfortable emotional level of development. Repression. Unconscious deliberate forgetting of unacceptable or painful thoughts, impulses, feelings, or acts. Sublimation. Diversion of unacceptable instinctual drives into personally and socially acceptable areas. Therapeutic relationship. Established between a healthcare professional and a client for the purpose of assisting the client with problem solving, grief counseling, and teaching. Initiating orientation phase. Establishes trust and rapport. Contract. Parameters of relationship made. Identifies problems and goals. Explore feelings. Confidentially and termination discussed. Working phase. Boundaries of relationship accepted teaches coping mechanisms. Client develops insight and problem-solving skills and identifies problems. Evaluate effectiveness of interventions. Termination phase. Begins with first session, evaluates outcomes, reassesses problems, goals, and interventions. Client may become dependent on nurse or have separation anxiety or feelings of rejection. Individual therapy, one-on-one sessions. Group therapy involves a therapist and 5 to 8 members who work on individual goals, promotes feedback and support. Family therapy. Member with symptoms show signs of familial problems, assumes changes in one member will bring changes in others. Milieu therapy. Physical and social environment that supports a client. Safety is most important. Includes an interdisciplinary team. Occupational therapy. Helps client recuperate from physical or mental illness that encourages rehabilitation through the performance of activities required in daily life. Behavior therapy assumes that symptoms of mental illness are learned behaviors, often uses positive and negative reinforcement, assertiveness training, and desensitization. Cognitive therapy assumes thoughts control behavior, identify cause, and replace thoughts with ones that have a positive outcome. Catholics avoid meat on Ash Wednesday and Fridays of Lent, may fast during Lent but excludes pregnant women, children, and ill. Jewish may eat cloven-footed animals that chew kind fish they have scales, milk, and meat prohibited, may fast during Yom Kippur, unleavened bread at Passover. Muslim pork, birds of prey, and alcohol prohibited, fasting during the month of Ramadan. Hindu vegetarians or won't eat beef or pork, children don't fast. Buddhism lacto-ovo-vegetarians, no alcohol, some eat fish, some avoid only beef. Mormon no alcohol or caffeinated drinks, often lacto-ovo-vegetarians or avoid only pork. Overeating prohibited, may go 5 to 6 hours between meals. Jehovah's Witness no blood added to food and meat must be drained on blood. Stress, a universal phenomenon, requires change or adaptation so client can maintain equilibrium. Alarm reaction, adverse stimulus, fight or flight response, increased epinephrine, norepinephrine, ADH, ACTH, and aldosterone, stage 1 of stress response. Resistance, prolonged stimulus, body adapts, stabilization, hormones levels normal again, and parasympathetic NS activated, second stage of stress response. Exhaustion, decreased immune response, depletion of hormone production, enlarged lymph nodes, decreased energy and physiological adaptation, third stage of stress response. Crisis intervention, acute, temporary state of severe personality disorganization with an extreme state of emotional turmoil. Acute crisis, overwhelming emotion, can't make decisions or problem solve, scattered thinking, social isolation, and immobilization. Exhaustion crisis, characterized by occurs under emergency conditions, loss of effective coping, non-functioning. Shock crisis, characterized by sudden external change, release of emotions, overwhelming. Phases of crisis response. 1. Vulnerable state. 2. Precipitating event. 3. Acute crisis or reorganization. Response to violence. Set consistent limits in form of consequences. Use seclusion and restraints as indicated. Get support help. Position self for an escape path. Completed suicide. Life ends. Attempted suicide. Failed self-destructive act. Suicide ideation. Thoughts of ending one's life. Catholic D. Priest anoints the sick. Sacraments. Jewish D. Prolong life. No one dies alone. A rabbi may be desired. No autopsy or cremation. Muslim D. Contact second-degree relatives. Face Mecca. Head elevated. Don't stop medical treatment. Have same gender handle dead body. Hindu D. Tie a thread around neck or wrist. Sprinkle person with special water. Basil leaf on tongue. Not removed after death. Buddhism D. Shrine and room. May use meditation. May refuse medications that alter awareness. Monk may recite prayers. Mormon D. May request sacraments. Jehovah's Witness D. No blood transfusions. Soul does not live after death. Abusers. These people are jealous, controlling, blame the victim, poor impulse control, low self-esteem, have unrealistic expectations, are often victims themselves. Tension building phase. Phase 1 of cycle of abuse. Acute battering incident. Phase 2 of cycle of abuse. Honeymoon phase. Phase 3 of cycle of abuse includes expressions of love, sense of calmness or respite. Acceptance. Recognizing the other person without inserting own values or judgments. Listening. Consciously receiving the client's message. Empathy. Experiencing another's feeling temporarily. Using silence. Suspending talk for a therapeutic reason. Neutral response. Showing interest and involvement without saying anything else. Self-disclosure. Sharing personal information at an opportune time to convey understanding or to role model behavior. Clarification. Putting into words vague ideas or unclear thoughts of the client invites client to explain and nurse to understand. Restating. Repeating to the client the main thought expressed shows nurse is listening and encourages PT to elaborate. Refocusing. Picking up central topics or cues given by client. Open-ended questions. Questions that enable communication. Incomplete sentences. Encouraging the client to continue and go on. Focusing. Helping the client explore a topic. Global aphasia. Cannot read, write, or understand speech. Broca's aphasia. Difficulty with speech but understands it, may read but may not write. Wernicke's aphasia. Cannot understand speech but can talk fluently, can't read or write. Selective mutism. Inability to speak under certain settings. Generalized anxiety disorder. excessive worry or anxiety about multiple issues for 6 or more months. SSRIs: fluoxetine, citalopram, sertraline, paroxetine, escitalopram. SNRIs: venlafaxine and duloxetine. Elderly: sertraline has a short half-life and is preferred for. Children: fluoxetine has a long half-life and is preferred for. Serotonin syndrome occurs when two SSRIs are taken together. Serotonin syndrome. S and S include agitation, restlessness, diarrhea, SHR, high BP, increased temp, hallucinations, loss of coordination, nausea, overactive reflexes, vomiting. Treat with benzodiazepines or cyproheptadine. Eating disorder, characterized by a persistent disturbance of eating or eating-related behavior that results in the altered consumption or absorption of food and that significantly impairs physical health or psychosocial functioning. Rumination disorder, regurgitating and rechewing food. Complications of anorexia, severe malnutrition, low potassium levels, heart problems, confusion. Complications of bulimia, constipation, dehydration, dental cavities, electrolyte imbalances, hemorrhoids, pancreatitis, swelling of the throat, tears of the esophagus. Signs of anorexia. Signs of bulimia. Autism spectrum disorder. Disorder characterized by difficulties in pretend play, social interactions, verbal and non-verbal communication, oversensitive senses, prefers routine, same body movements, has unusual attachments to objects, cause unknown. ADHD. Disorder characterized by hyperactivity, impulsivity, inattentiveness. Autism treatment. Applied behavior analysis, medications, gluten or casein-free diet, various therapies and support groups. ADHD treatment. Set goals, administer medication, dextroamphetamine, lisdexamphetamine dimesylate, talk or behavior therapy, support groups. Obsessive-compulsive disorder. An anxiety disorder in which people have unwanted and repeated thoughts, feelings, ideas, sensations, or behaviors that make them feel driven to do something. Person is aware of disorder, affects functionality. Body dysmorphic disorder. Disorder that involves being obsessed with being ugly or part of body is abnormally shaped. Trichotillomania. Disorder that has persistent hair pulling. Excoriation disorder. Disorder where person persistently picks skin. Paranoid personality. A personality disorder characterized by a pervasive pattern of distrust and suspicion of others resulting in a tendency to attribute the motives of others to malevolence. Schizoid personality. A personality disorder characterized by shyness, withdrawal, inhibition of emotional expression, and apparent diminution of affect. Schizotypal. characterized by exhibiting impaired disorganized patterns of thought, perception, communication, and behavior suggestive of schizophrenia but not of sufficient severity to warrant a diagnosis of schizophrenia. Antisocial personality. Borderline personality disorder. A disordered behavior pattern with onset by early adulthood that is characterized by multiple types of psychological instability and impulsiveness, often involves fear of abandonment and risk of suicide, and may ameliorate with age. Histrionic. Personality disorder where person draw excessive attention to themselves, dramatic, sensitive, seeks approval. Narcissistic. A personality disorder characterized especially by an exaggerated sense of self-importance, persistent need for admiration, lack of empathy for others, excessive pride in achievements, and snobbish, disdainful, or patronizing attitudes. Obsessive-compulsive personality disorder. Personality disorder where rules, orderliness, and control are exhibited to the extreme, occurs more often in men. Paranoid schizophrenia. Schizophrenia characterized especially by persecutory or grandiose delusions or hallucinations or by delusional jealousy. Schizophrenia. A psychotic disorder characterized by loss of contact with the environment, by noticeable decreased functioning in everyday life, and by disintegration of feeling, thought, perception, and behavior. Sertraline and Paroxetine. Medications approved for the treatment of PTSD include PTSD. Disorder characterized as reliving the event, hyperarousal and avoidance, caused by a traumatic event. Reactive attachment. Disorder that occurs from neglect during infancy of childhood, avoids contact and wants to be alone. Disinhibited social engagement disorder. Stress-related disorder where a child freely goes to strangers or unfamiliar environments and may show inappropriate behaviors despite age differences. Conduct disorder. A set of ongoing emotional and behavioral problems that occurs in children and teens. Problems may involve defiant or impulsive behavior, drug use, or criminal activity. Antidepressants. With these drugs, avoid alcohol, don't stop drugs suddenly, and know that the therapeutic effect may take 8 weeks. Escitalopram. This SSRI has a fast onset. Paroxetine. This SSRI has many drug interactions and can cause bruxism and restless leg syndrome in the elderly. Bupropion. This drug is a norepinephrine and dopamine reuptake inhibitor, has less side effects but may decrease libido, also used for anti-smoking therapy. Tricyclic tetracyclics. Amitriptyline, imipramine, nortriptyline, doxepin, clomipramine, mirtazapine. Often used when SSRIs don't work. Don't use if client has glaucoma, urine retention, or in acute recovery of MI. Tricyclics. Side effects of these drugs include dry mouth, constipation, bladder problems, sexual problems, drowsiness, blurred vision, can cause neuroleptic malignant syndrome. Neuroleptic malignant syndrome. Syndrome caused by tricyclic medications, severe diarrhea, fever, sweating, muscle stiffness, or tremors. MAOI. Class of drug, phenelzine, phenylcypromine, isocarboxazide, silicoline patch. Don't give if colitis, hypertension, heart failure or disease, renal dysfunction, stroke, HX of HOP, and liver disease. Hypertensive crisis. Caused by increased tyramine level. Avoid yogurt, cheese, pickles, and wine and decongestants while taking MAO ice. Trazodone is an atypical antidepressant. Withdrawal symptoms include agitation, anxiety, confusion, dizziness, headache, and insomnia. Don't give for under age of 18. Atypical antipsychotics. Clozapine, risperidone, olanzapine, quetiapine, aripiprazole, paliperidone, ziprasidone. Side effects of atypical antipsychotics. Sedation, insomnia, weight gain, dizziness, hypotension, agranulocytosis. Typical antipsychotics. Chlorpromazine, thiazide, trifluoperazine, fluphenazine, thiothexine, haloperidol, molendone. Side effects of typical antipsychotics. Agitation, agranulocytosis, anticholinergic, orthostatic hypotension, extrapyramidal symptoms, sedation, tardive dyskinesia due to long-term use and malignant syndrome. What are the primitive defense mechanisms? Denial, regression, acting out, dissociation, compartmentalization, projection, and reaction formation. What are the mature defense mechanisms? Repression, displacement, intellectualization, rationalization, and undoing. What is compensation? Extra effort in one area to offset real imagined lack in another area. What is an example of compensation? Says they can't cook, but says they can do dishes. What is conversion? Mental conflict expressed through physical symptoms. What is an example of conversion? Woman becomes blind after seeing husband with another woman. What is denial? Treating obvious reality factors as though they don't exist because intolerable. What is an example of denial? Alcoholics saying they don't have a drinking problem. What is displacement? Transferring unacceptable feelings aroused by one object to another. What is an example of displacement? Adolescent lashes out onto parents after not getting invited to a party. What is dissociation? Walling off specific areas of personality from consciousness. What is an example of dissociation? People with history of childhood abuse suffer from some sort of dissociation. What is fantasy? Conscious distortion of unconscious wishes and need to obtain satisfaction. What is an example of fantasy? Nurse fails critical care exam and daydreams about heroic role in cardiac arrest. What is fixation? Stagnated in a level of emotional development in which one is comfortable. What is an example of fixation? 60-year-old woman who dresses acts as if she is in the 60s. What is identification? Subconsciously attributing to oneself qualities of others. What is an example of identification? Elvis impersonator. What is intellectualization? Use of thinking, ideas, or intellect to avoid emotions. What is an example of intellectualization? Parent becomes extremely knowledgeable of child's diabetes. What is introjection? Incorporating traits of others. What is an example of introjection? Husband's symptoms mimic wife's before she died. What is projection? Unconsciously projecting one's own unacceptable qualities, feelings onto others. What is an example of projection? Woman who is jealous of another woman's wealth accuses her of being a gold digger. What is rationalization? Justifying behaviors, emotions, motives considered intolerable through acceptable excuses. What is an example of rationalization? I didn't get chosen for the team because the coach plays favorites. What is reaction formation? Expressing unacceptable wishes, behavior by opposite overt behavior. What is an example of reaction formation? Recovered smoker preaches about the dangers of secondhand smoke. What is regression? Retracting to an earlier and more comfortable emotional level of development. What is an example of regression? After moving to a new home, a 5-year-old wets the bed again. What is repression? Unconscious, deliberate forgetting of unacceptable painful thoughts, impulses, feelings, acts. What is an example of repression? Adolescent forgets appointment with counselor to discuss final grades. What is sublimation? Diversion of unacceptable instinctual drives into personally socially accepted areas. What is an example of sublimation? Young woman who hated school becomes a teacher. What is the psychoanalytic theory? Introduced concept of mind as a structure incorporating the id, ego, and superego part of each persona's mental functioning equals conscious and unconscious. What is the treatment associated with the psychoanalytic theory? Helping make the unconscious conscious. What are defense mechanisms used for? To defend the ego from conflicts between it and superego. What is the interpersonal theory? Personality develops according to the client's perception of how others view them. Healthy personality equals healthy relationships. What is the nurse-client relationship to be according to Kaplan? Client receives unconditional acceptance. Relationship between nurse and client is patient-centered relationship developed according to client's perceived readiness. What is the cognitive behavioral theory? Focuses on premise that a person's thoughts control their behavior. What is the treatment associated with CBT? Patient to replace current thoughts with ones that produce a more desirable outcome. What is CBT used for? Help patients manage symptoms of their illness and live a fuller life. If a patient is behaving in an unwanted way, how do we use the CBT to help them? Important to identify the thoughts that are causing these feelings, behaviors. What is the behavioral theory? Symptoms of mental illness equals from learned behavior through use of positive or negative reinforcement. Unacceptable learned behavior can be replaced by more desired behavior.